Ever wondered what happens when the heart's aortic valve narrows? Welcome to the fascinating world of aortic valve stenosis. This intriguing topic is a staple in medical education, often appearing in the USMLE Step 1 exam. We'll be exploring its causes, how it affects the heart, the signs and symptoms it presents, how it's diagnosed, and the various treatment options available. So, strap in and get ready to learn. Follow along as we delve into the world of aortic valve stenosis. First, let's understand what causes aortic valve stenosis. This condition can stem from various sources, yet the most prevalent cause is degenerative calcific disease, where calcium deposits cause the valve to harden and narrow. Other causes worth noting include congenital bicuspid aortic valve, a condition where the aortic valve only has 2 leaflets instead of the usual 3, and rheumatic heart disease, which can result from untreated strep throat or scarlet fever. Aortic valve sclerosis, a thickening of the aortic valve, is a less common cause. Now let's delve into the pathophysiology. Aortic valve stenosis involves the narrowing of the aortic valve. This narrowing obstructs the blood flow from the left ventricle into the aorta, creating a pressure overload in the left ventricle. This pressure overload can lead to left ventricular hypertrophy, which is the thickening of the ventricular wall, and can eventually result in impaired cardiac function. Now that we know the causes and pathophysiology, how does aortic valve stenosis present clinically? Let's delve into the symptoms, physical examination findings, and diagnostic tests that help identify this condition. Patients with aortic valve stenosis may first come to medical attention due to symptoms such as angina or chest pain, resulting from the heart working harder to pump blood through the narrowed valve. They may also experience dyspnea or shortness of breath, especially during physical activity, as the heart struggles to supply enough oxygen-rich blood to the body. Syncope or fainting can also occur often during exertion due to reduced blood flow to the brain. During a physical examination, doctors may discover a harsh systolic ejection murmur, which is a heart sound that occurs when the heart contracts and pushes blood through the aortic valve. This murmur is typically heard best at the right upper sternal border. Other findings may include a narrow pulse pressure, reflecting the reduced blood flow through the aortic valve, and delayed carotid upstrokes, known as pulsus parvus et tardus, which are a sign of the slowed blood flow out of the heart. For diagnostic tests, echocardiography is the go-to imaging method. It can visualize the aortic valve and measure the severity of the stenosis and the function of the left ventricle. An electrocardiogram, or ECG, may reveal signs of left ventricular hypertrophy, a condition where the heart's main pumping chamber becomes thickened due to the increased workload. A chest X-ray can also be useful, as it can show left ventricular hypertrophy and calcification, or hardening, of the aortic valve. These tests help confirm the diagnosis of aortic valve stenosis. Diagnosis confirmed. But how do we manage aortic valve stenosis? Management of aortic valve stenosis is a two-pronged approach, focusing on symptomatic relief and addressing the underlying issue. For symptomatic relief, medications like beta blockers and nitrates can be used. These drugs help by reducing the workload of the heart, and thus alleviating symptoms such as chest pain and shortness of breath. However, keep in mind, these medications are not curative. They do not reverse the stenosis or halt its progression. This brings us to the crux of the matter, the definitive treatment for severe aortic stenosis: surgical intervention. Aortic valve replacement is an open heart surgery where the diseased valve is replaced with a mechanical or bioprosthetic valve. This procedure comes along with its own set of risks and benefits that need to be weighed out for each individual patient. But what if the patient is high risk or inoperable? Enter the transcatheter aortic valve replacement, or TAVR, a minimally invasive procedure that implants a new valve within the stenotic valve. It's a game changer for patients who were previously deemed inoperable. Knowing when to opt for surgery is critical, based on the severity of stenosis, symptoms, and left ventricular dysfunction. Understanding these factors allows for a tailored approach to management, optimizing outcomes for each individual patient.